Assalamualaikum and good day to everyone. Thank you for giving me the opportunity to present my infographic poster entitled The Heart of Healing, Ethical Communication in Occupational Therapy. As an occupational therapist working in Putrajaya Hospital, I interact with patients from different age groups, cultures, and medical conditions every day. Through this experience, I have come to realize that successful rehabilitation is not determined solely by clinical skills or therapeutic techniques. Instead, it often begins with something much simpler but equally powerful: a meaningful conversation. Allow me to begin with a simple scenario. Now, imagine a 62-year-old gentleman who has recently suffered a stroke. During his rehabilitation sessions, he repeatedly refuses to participate in therapy. At first glance, it may appear that he lacks motivation or is being uncooperative. However, when the occupational therapist pauses, listens actively, and asks, "Can you tell me what worries you the most?" To which the patient finally reveals that he is terrified of falling again. At the moment, nothing about his physical condition has changed, yet everything about the therapeutic relationship has changed. This scenario illustrates why I chose the title, The Heart of Healing. Ethical communication is not simply the exchange of information. It is the foundation upon which trust, collaboration, and meaningful rehabilitation are built. My infographic centers on one key message: ethical communication builds trust. Trust strengthens the therapeutic alliance, and a strong therapeutic alliance leads to a better rehabilitation outcomes. The first section explains why ethical communication matters. Ethical communication is guided by important professional principles include beneficence, non-maleficence, autonomy, veracity, justice, and fidelity. These principles ensure that occupational therapists communicate honestly, respectfully, fairly, and always in the patient's best interest. When patient feels respected and psychologically safe, they are more willing to express their concerns, goals, and personal experiences. This trust enables occupational therapists to gain a deeper understanding of what truly matters to the patient, allowing interventions to be individualized and meaningful. The next session presents 5 practical habits that support ethical communication in everyday clinical practice. The first is active listening, where therapists pay attention not only to what patients say, but also to their emotions and nonverbal communication. The second is speaking with clarity, by using plain language and the teach-back method to ensure patients genuinely understand their treatment plans. The third is shared decision-making, where therapist and patient works together to establish goals based on both clinical evidence and the patient's own values and priorities. The fourth is cultural humility, where recognizing that every patient brings unique beliefs, tradition, and lived experiences into the therapeutic process. Rather than making assumptions, occupational therapists respectfully explore these perspectives and adapt their communication accordingly. Finally, ethical communication requires maintaining confidentiality and professional integrity, ensuring that patients' privacy, dignity, and trust are consistently protected. This clinical scenario on my poster demonstrates the impact of this communications behavior. Instead of focusing only on completing therapy tasks, the occupational therapist first seeks to understand the patient's fear. Through empathy and active listening, the patient feels heard, trust begins to develop, therapy goals are adjusted collaboratively, and participation gradually improves. This demonstrates the concept of the therapeutic alliance, a collaborative partnership built on trust, mutual respect, and shared goals. Research consistently shows that a strong therapeutic alliance contributes to a greater patient engagement, improved adherence to therapy, higher satisfaction, and ultimately better rehabilitation outcomes. As an occupational therapist at Putrajaya Hospital, this topic is highly relevant to my own professional practice. Every day, I work with patients experiencing physical disabilities, neurological conditions, and challenges in performing meaningful daily activities. While therapeutic techniques are important, I learned that patients are much more likely to engage in therapy sessions when they feel genuinely listened to, respected, and involved in decisions about their own care. In conclusion, ethical communication is not simply a professional responsibility, it is the heart of occupational therapy practice. Every conversation presents an opportunity to build trust, strengthen the therapeutic alliance, and empower patients to achieve meaningful participation in daily life activities. I would like to conclude with the central message of my infographic. Ethical communication is the heart of occupational therapy. Through active listening, cultural humility, truthful dialogue, and shared decision making, occupational therapists build therapeutic alliances that protect dignity, inspire trust, and achieve meaningful rehabilitation outcomes. Thank you for your attention.